Hey everyone, my name's Nate Hayden, and the disease I chose to do my presentation on is botulism caused by Clostridium botulinum. So, botulism is a rare but serious illness caused by a toxin that attacks the body's nerves and causes difficulty breathing, muscle paralysis, and even death. In the USA, an average of 145 cases occur each year. 50 years ago, for every 100 people diagnosed with botulism, 50 people died. Thanks to advancements in medicine, only 5 out of 100 people die from botulism. The mortality rates of botulism are foodborne, 5 to 10%, wound botulism, 15 to 17%, and infant botulism is 1%. The average recovery time is 30 to 100 days. So the bacterium is called Clostridium botulinum. So Clostridium botulinum belongs to the family Clostridia, which are all obligate anaerobes. And this bacterium is just a typical prokaryote. So here's a picture of an electron microscope. So as you can see, they're just typical prokaryotes, nothing really, no distinguishable features really on them. Clostridium botulinum reproduce through binary fission. Clostridium botulinum also form vegetative endospores. And they're gram-positive and obviously are bacillus shaped. So the bacterium produce botulinum toxin, which is a neurotoxin that causes botulism. It's a neurotoxic protein that prevents release of the neurotransmitter acetylcholine at the neuromuscular junction from axon endings. This results in paralysis. Clostridium botulinum produces this toxin, and this toxin is used for cosmetic reasons such as Botox on wrinkles and other similar procedures. Botulinum toxin is also used for many medical purposes. This includes treatment of cerebral palsy, post-stroke spasticity, and refractory overactive bladder. We're now going to watch a video on botulinum toxin.
Now, nerves that use the neurotransmitter acetylcholine are those we use for muscle control. Upon ingesting a contaminated food product, botulinum toxin works by binding specifically to these nerves, inhibiting muscle contraction. The toxin comes in 8 distinct types, named A, B, C, D, E, F, G, and H, and they vary in their toxicity. The neuron takes in the botulinum toxin by endocytosis, creating a small vesicle that floats within the neuron's cytoplasm. The toxin then activates and slips out of the vesicle and starts to cleave snare proteins. Snare proteins tug vesicles containing acetylcholine to the plasma membrane, where they get released into the synapse and transmit a signal to the muscle. Without snare proteins, acetylcholine doesn't get released, so no signal is sent out by the affected nerves. The result is that the muscle gets completely relaxed and flaccid. Muscle weakness usually starts in the muscles supplied by the 12 cranial nerves, so the muscles that control the face, eye movements, chewing, and swallowing. In addition, nerves of the autonomic nervous system that rely on acetylcholine are also affected.
Pretty cool stuff, huh? Anyways. So the environment needed for botulism, for the Clostridium botulinum to reproduce, is high moisture, low salt, and low sugar, and a high pH environment. Clostridium botulinum is an anaerobic bacteria, so they grow, they need to have absence of oxygen. And they also reproduce best when they aren't refrigerated. So when people are like canning foods and they don't can them properly and they don't refrigerate them, that's like the most optimal environment for Clostridium botulinum to reproduce. Earlier in the video that we showed, it also says how the endospores form. They form when the bacterium come in contact with oxygen, and then they like spread out, and then when the environment is optimal again, the spores can grow into the bacteria. And so that's one way that they can like travel and go into people's wounds and into food sources and infants' intestines, that's how infant botulism is caused. So moving along, we've already kind of covered this, but I'll just go over the 5 kinds of botulism. So the first is foodborne. This kind of botulism happens from eating food that is contaminated with the botulinum toxin. The most common source of foodborne botulism is homemade foods that are improperly fermented and preserved. The second is wound botulism. This type of botulism occurs when the bacterium or the toxin enters the wound. Wound botulism can happen from a wide range of injuries. The most common one that is seen in like a medical field is injection, like when you are injecting like illegal drugs. So that is a big cause of botulism, wound botulism specifically. But it can happen from any kind of wound, like severe motorcycle accident or cut or anything. The third form is infant botulism. This form of botulism happens when the bacterium enters the intestine of a child and the bacteria grow in the favorable conditions of the intestine. The fourth type of botulism is adult intestinal toxemia. This type of botulism is essentially the same kind of botulism as infant botulism, but it just happens in adults. And for whatever reason, the bacteria can enter an infant's intestine easier than an adult intestine, and so that's why this is one of the most rare forms of botulism. The fifth and final kind of botulism is iatrogenic, and this is the kind of botulism that happens when the bacteria enters the body through the injection of Botox or other procedures that are for cosmetics, and those injections use the botulinum toxin. Okay, so the symptoms of botulism include double vision, drooping eyelids, slurred speech, difficulty swallowing or breathing, a thick feeling tongue, dry mouth, and muscle weakness. So all of these things kind of revolve around the muscle paralysis that is involved with the toxin, the effect of the toxin on the acetylcholine receptors. Infants with botulism may appear lethargic, feed poorly, be constipated, have a weak cry, and have poor muscle tone. Here's a picture of an infant with infant botulism. So you can see that the muscle tone is very weak. The diagnosis of botulism is easier said than done. This is because many diseases show similar signs and symptoms as botulism. These diseases include Guillain-Barré syndrome, stroke, and opioid overdose. Some tests that doctors perform include brain scan, spinal fluid examination, and nerve and muscle function tests like NCS and EMG tests. Ultimately, laboratory tests are the only surefire way to know if the bacterium or the toxin is present. So here's another picture of someone that got botulism, and you can see that their eyes are drooping and their pupils are really wide and they're not moving. So that is from the paralysis. The treatment of botulism is treated with a drug called antitoxin. The antitoxin only prevents further damage to nerves, and it doesn't actually undo any damage that has been done. Most patients that suffer from botulism have to stay in the hospital for weeks and even months before they can return home. Wound botulism treatments require surgical removal of any area that has been affected by the bacterium at all. And the most common way that people die from botulism is when it enters the respiratory system and causes paralysis of the muscles in the respiratory system. And so when this happens, they're always put on a ventilator until they are able to breathe on their own. And so that's the treatment of botulism. The prevention of botulism mainly is just through foodborne procedures, like just being aware of like what foods are more likely to grow the bacteria. So this includes like low acid content foods like asparagus, green beans, potatoes, corn, and beets. And again, not refrigerating them is one way to help the bacteria grow. Cleaning out wounds thoroughly is another good way to prevent wound botulism. Infant botulism is not very preventable, but a lot of studies show that honey, if you give honey to a child that is less than a year old, they are more likely to get botulism. So don't give honey to your 1-year-olds if they're less than 1 years old. But yeah, the most important thing is just early detection of symptoms and signs, and that is how you can prevent botulism. Thanks for watching.